I'm Dr. Jam Katari.
And I'm Dr. Sally Moore. And this is a Myeloma Minutes, a podcast for people affected by myeloma, patients, friends and family. Hi Jam, lovely to see you again. Good morning. Here we are on a Thursday morning having another chat about myeloma. How have you been?
Very well, thank you, Sally. And today is a really interesting, exciting podcast because this is the first time we're going to have a patient talking about her experience.
We thought this was so important, particularly on the back of the Steroid podcast, which has recently been released, but also what better than to hear actually the reality of a situation and managing a condition, bar from a person who's lived through it and is living with it. So we're delighted to have these really special guests with us today to share their experiences of living with myeloma, but I guess the focus is also coping with steroids. So Katy, let's introduce you. Thank you so much for joining us. We're just wondering if you could tell our listeners a tiny bit about yourself, a little bit about how myeloma has been for you, what happened when you were diagnosed and where you are now.
Hi, Sally. Hi, Jam. Thank you so much for inviting me onto your podcast. I was diagnosed in 2018. I was in my early 40s. I had two fairly young children at the time. My son was 4 and my daughter was 7. And I was working as a lawyer in London in a fairly senior role. And it came completely out of the blue. I'd never even heard of multiple myeloma when I was told that's what I had. In fact, I think I said, "Oh, what's that?" Having no idea of the implications of the diagnosis. And my myeloma was fairly advanced when I was diagnosed. So there are about 70% myeloma cells in my bone marrow when I have my biopsy. So my treatment was pretty swift. I started radiotherapy and prophylactic chemo. And then in early 2019, I had a stem cell transplant and then more chemo after that. And then I've been on maintenance chemo ever since under Sally's care.
Oh, well, it's been a total pleasure, working with you and finding our way through things together. But Katy, I remember the first time I met you and you described what it was like to be diagnosed. And I think often people who are living with myeloma have those events, those days in their life where nothing will ever be the same again once they are told they have that news. And I suspect that was your experience. Would you suggest or agree that was the case?
Oh, completely. I think it's the words that everybody dreads, that conversation that you sort of see maybe in a drama on TV or a soap opera. And then when it actually happens to you and somebody says these words, the bottom just falls out of your world. And of course I did the thing that you're absolutely not supposed to do, which is immediately contacted Dr. Google. And I just remember just being completely floored. And I think with myeloma in particular, because it's a blood cancer and also it's not curable, although it is treatable at the moment, I think it was also quite confusing trying to get my head around exactly what that meant for me. Because a lot of the things I knew about cancer treatment, like, for example, having an operation to remove a tumour, those things just aren't applicable to myeloma diagnosis. So I think that was really hard. And I just remember my husband and I just sitting by the Thames because we were in London at the time and just thinking, well, what does this mean? Where are we going to, what does it mean for the next year, 2 years, 5 years? What does our future look like? And suddenly your future becomes a very, very different landscape to the future that you'd probably be planning for and envisaging.
Absolutely. And of course, you had your children to consider as well at such a young age too. And then a busy job. And I'm sure, Katy, knowing you as I do, hopefully quite a busy social life as well. So life changed significantly, I imagine. But here you are on maintenance treatment, and I think it's fair to say things are going well.
Yeah.
But when you did get that diagnosis and you did have the bone marrow test and all the scans which were needed and such like, as you said, you were treated swiftly, and by that I'm interpreting you started on chemotherapy. Could you tell me a little bit about that? And then maybe we can move on to one component of the chemotherapy, particularly the steroids, and what that was like for you.
Yeah, so I started, I had all the sort of initial tests in the first week. And I think my experience was I was, a busy working mum, and I'd had lots of things really when I look back that were indicative of not being very well at all, but I pushed aside. But almost when I began having all the tests, it was as if my body just suddenly collapsed and said, yes, I'm really ill, and thank goodness you're actually listening to me now. So I think I became very ill quite quickly. And I started my chemos very swiftly as well. And it was a combination of an injection and steroids. And I was on dexamethasone, or as we like to call it, Dexy's Midnight Runners.
Brilliant. Do you know what? I think you've mentioned that to me before, but I've never heard anybody else say that. You might have started a new trend.
That's a new one. I mean, Dexy's Midnight Runner. I mean, it probably shows all of our ages, but we can just, it captures some of the points perfectly.
Yeah, I was on a lot initially. I had 2 days when I was taking steroids, and I can't remember how many it was. I think it was at least 10. It was a lot. Does that sound about right?
Well, often actually, particularly when you were diagnosed, we would have given 40 milligrams as what we call a pulse. So for 4 days, which is 20 of those small tablets over 4 days. And then I think you had Velcade treatment, didn't you?
Yeah.
And we tended to give it on the day of Velcade and the day after as well.
Yeah.
Is that how you recall it?
Yeah, exactly. Yeah. It was about 20 one day, 20 the other. So yeah, I think it would be fair to say I was buzzing on the day of my Velcade injection. So I think we sort of quite quickly as a family got into this cycle where we knew that Mummy was going to be slightly crazy for 2 days, and then there would be the big crash afterwards. And I think my treatment was Tuesday and Wednesday I took my steroids. So usually Thursday and Friday I would just be completely exhausted. So once we kind of understood that, we started to adapt sort of family life to the fact that, you know, Thursday and Friday had to be really quiet days because I would just be exhausted. And then the crazy days, fortunately have a brother who lives in Australia, which is quite handy in terms of dexamethasone insomnia, because when I couldn't sleep, I would call my brother. We would chat, and I was also a big fan of. I am a big fan of podcasts. That's why I'm here. Very pleased to have your podcast joining the Stronger podcasts.
Thank you.
And I think I remember listening to one about Benazir Bhutto and her life. I became a bit of an expert on Benazir Bhutto for a few weeks because I just literally listened to this stuff throughout the night and ate a lot of ice lollies randomly.
Oh, fair enough. Fair enough. So did you notice then a change in your appetite? Because some people report that. Or was it just a peculiar ice lolly sort of, wish that you fulfilled?
I mean, I had very quickly, a lot of reactions, gastro reactions to all of the medication. And yeah, I would say my appetite dropped off pretty rapidly. And I sort of wanted things that were sort of quite textural, quite dry. Yeah, there were quite bizarre things that I sort of really fancied eating, which included ice lollies. And I also recall there was a particularly fine prawn cocktail that I became slightly obsessed with.
How strange, a bit like being sort of having those pregnancy cravings again, maybe.
Yeah, except with less of a joyful ending of a baby.
Indeed.
It's really interesting. I think when you're on chemotherapy, changes in taste and changes in which you want to eat are so common, but they are very individualized.
Yeah.
And, through sort of understanding that, your body said, this is actually what I want. So whether it was things that were quite acidic, for example, like maybe in the mayonnaise or citrus from lollies, like some things just work out better for some people at different stages. So it's maybe that the Velcade did one thing and the steroids increased the appetite in some ways, and that led you to an ice lolly prawn cocktail combination, which I have to say together doesn't sound great, but I'm glad it worked for you at the time.
Yeah, I'm just thinking a prawn cocktail ice lolly would be a sublime invention. Yeah, I think. I mean, as the chemo went on, my taste definitely changed. My appetite hugely reduced and the sickness started. One of the most difficult side effects was the fact that I no longer enjoyed a glass of wine, which slightly broke my heart. But I think the bitterness of wine was really, really difficult. And there seemed to be a bit of a craving for things that were quite sweet as well. But overall, just appetite began to just fall through the floor.
Yeah. And then, Katy, to pull you back to what you describe as the crazy days, often we find that patients' families, their loved ones, notice a change on those crazy days as well, apart from the lack of sleep. Did your husband, did your kids notice that you were different when you were sort of, as you described, buzzing from the steroids?
Yeah, and they definitely saw that I was quite hyper. And I think one of the things I had to be really careful about was not then overdoing it the days that I was feeling really hyped up, because you sort of feel that you've got this energy. And I think I embarked on starting to walk the Thames path because I felt like really energized on the days I was having my Dex. And I quite clearly realized that was maybe not my best kind of approach, because of course that just exacerbated the exhaustion once I came off the steroids. So I think just really leaning into it as well, accepting this is how it was going to be. And the children, as I say, they got quite used to the fact that, Thursday and Friday were mummy's quiet days and I would be very sleepy. I'm not sure if I asked them which one they'd say they preferred. I might have been the ones where I was quite sleepy.
So after you'd been pushing them on the swing for 2 hours, it's like, Mummy, I want to get off. No, just another half an hour. We'll be fine. It's like the park is dark and they're still on the swings going, oh, I need one of Mummy's sleepy days. But I mean, what you have described, Katy, is very common in terms of a dip when you come off the steroids. And on the steroid pod, we talked about ways to potentially mitigate that. Did you look at changing the way in which your steroids were dosed in discussion with your consultant then? Were different approaches looked at, or did you get used to the rhythm of it and it was okay with you?
One of the things I learned really early on was, because I was given my Dex when I went in for my Velcade injection, I think I learned really quickly to say to my nurses, give me the dextromethasone like as soon as possible. So that became a priority, that as soon as I went in the morning, the first thing they do would be to give me my Dex, because I found if I had it earlier on, I was more likely to be able to sleep better that evening. Whereas the days perhaps that I was waiting around for things or waiting for bloods to come back and I didn't get my Dex until midday, then sleeping was a lot more difficult. So I think taking my Dex as soon as possible was definitely something I prioritized, and that helped quite a lot. So that's one thing that we did do. As I say, just really sort of accepting, what was going to happen and how I was going to feel. I did also, which I didn't mention, get massive gerbil-face, which I looked back at some photos of me just before I went for my stem cell. I was very attractively sporting a massive gerbil-face with a sort of balding head, which it's a look. It's not a look that I think is going to be on the front pages of Vogue anytime soon. But yeah, I did really. I just think there was one day I just looked in the mirrors of the lifts as I was in the hospital, and I suddenly looked at my face and said, "Oh my God, it's my face been looking like that for a while." And Martin was like, "We're sort of mentioning this."
I wouldn't describe you as that now. Do you think that's fair to say? Is everything now normalised back to the look that you're more familiar with? You are now you again, aren't you?
Balding gerbil-face. Yeah. Well, yes. I'm hoping that's not how I would be described. No, I mean, my hair, I was pretty lucky. My hair did fall out, but I've always had quite short hair, and I think I quite rocked a buzz cut actually, so that was okay. And yeah, my face, once I came off the Dex, my face thinned down quite quickly. But it is disconcerting when so much is happening to you. I think suddenly your body no longer feels like yours. It feels like it's been, that autonomy that you're so used to having over sort of your body and what happens to your body, it just gets almost given over to these specialists, and you just sort of have to submit to things that normally you would say, I'd really rather you didn't do that if you don't mind.
Mm.
And yeah, that changed appearance is one of those things that you sort of have to come to terms with and figure out, the best ways to manage it. I found one of the best ways to manage it was to buy nice jewellery and expensive headscarves, which pleased both my bank manager and my husband.
Whatever way you can get around it. But just to clarify on that point though, so the gerbil-face, I think we can safely attribute that to the steroids, but the hair loss was probably the transplant. Is that how you remember experiencing it?
Yeah, it thinned a lot during my chemo. So by the time I went in for my stem cell transplant, I think I was sporting a bit of a comb over. It was all thinned at the back as well. And I began to see like hair, I wake up in the morning and there'd just be hair all over my pillow.
Yeah.
But then after my transplant, any remnants of hair that I was sort of attempting to style in some way or another just completely went. So yeah, that the stem cell definitely finished the hair off. But the extreme weight loss then mitigated the gerbil-face. So you kind of win some, you lose some.
What an approach. What a wonderful way of looking at it, Katy. And your resilience and your humour through this, I suspect has been a real support for you. Could I pull in a few other strands of conversation which we've shared before? One of which is you also shared that during those sort of steroid nights when you were not chatting to your brother, you were writing a journal, is that right? Or were you writing things down and sort of processing in a different way?
Yeah, I started a blog quite soon in after I was diagnosed, partly because I have always loved writing. And so that's always been a way that I've expressed myself. But I think also it becomes very exhausting, especially in the early stages of trying to respond to all the questions and inquiries about how you are and how did this happen. And so I wrote this blog really in an effort to process for me, but also to communicate to the people that I cared about and who cared about me and what was happening to me. And so, I published this blog, which I circulated to my family and friends. And actually, it became a huge help. I wrote it, all the way through my stem cell transplant. Looking back on it now, it's also a reminder of how tough some of those times were. And being able to pour it out, I think, into something else really helped me sort of get through some of the darkest days, probably.
Do you still go back and read any of that, Katy?
I have gone back and read bits of it, but actually, I've also been contacted by friends or even friends of friends who've said they've got somebody who they know who's been diagnosed with myeloma. And it's something that I have then passed on to them and said, with a bit of a health warning, but said, I wrote this blog. There was also one particular blog post I wrote, which I've actually passed on to quite a few people, not just those who've been diagnosed with myeloma, but other cancers, which basically said, here's what I want you to say and do. Here's what I really don't want you to say and do. A bit of a sort of top tips for how to manage loved ones or friends with cancer. So I just put things in there like, don't just say, oh, I'm here if you need me, or just let me know if there's anything you can do, because that puts an onus back on the person who is unwell and their family to actually ask you to do something. If you want to do something, just do it. So I had some great friends and family who would just do things like drop homemade soup and bread on the doorstep. So that's been actually really helpful, and I have passed it on to people. And at some point, I keep thinking I'm going to work it up into a book, but I'm trying to squeeze that in between being a mum, working again, and setting up my own business. And as yet, I haven't got to it.
But doesn't the biography of Benazir Bhutto come first? I'm assuming that's nearly finished.
Yeah. My continuing research and PhD thesis on Benazir is obviously, the first priority. But she's very interesting. In fact, I have a blog post that was entitled Ice Lollies and Benazir Bhutto.
Brilliant.
I tell you what, that's fantastic. I mean, I have to say that point around, please let me know if there's anything that I can do, and shifting the onus. I think the way you sort of express that, I think, is really something, actually. And I think it's something for all of us, because I've sent that in a text so many times. Please let me know if there's anything that I can do. And you're right, it does actually just shift the onus back on to the person, doesn't it?
Although well meant, I think it's one of those phrases that people sometimes use to make maybe themselves feel better, because they feel like, oh, I've reached out. And actually what people need at that time is just offers of help. And actually that's one of the things I've also said to friends, again, who are either have been diagnosed themselves or have family members who are diagnosed, which is, accept every offer of help that you're given. Don't be proud, because you need it. And, we really needed it, because my husband was continuing to work and he was now pretty much, single parenting. And we needed those neighbours who said, when Martin came home from seeing me in hospital, by the way, you're all coming around to dinner at our house today, so just pop over. And so Martin didn't have to think about cooking meals for everybody when he got home. And it was things like that that just made a huge difference to us as a family.
Well, Katy, amazing insights. So just to wrap up, if we use that template of the good, the bad and the ugly, are there a couple of words you could assign to the good bits of steroids, if they exist, and the bad bits, and then the not so charming bits? I'm assuming the gerbil-face might, I don't know, fit in there somewhere, but over to you.
Obviously the good bits are they help get rid of my cancer. So I think that's a definite, I'm going to go for a definite plus point there. Also, if you were particularly into, all night raving, also very helpful. The bad is the exhaustion. And probably the ugly has to go down as gerbil-face, I would say.
Well, what a way to end. What a way to end. A massive thanks for joining us.
You are
truly
really,
lovely
really
to speak to you again. It always is.
Okay.
And thank you for sharing your insights.
You're very welcome, and lovely to meet you too, Jam. And good luck with the podcast.
Thank you so much for those lovely insights and really brilliant discussion. Wishing you all the best.
Thank you so much.
Wow, Jam. So wonderful to hear Katy's story. And obviously I know her so well, but this is the first time you guys have met each other. So what are your take-home messages, you think, from this first patient podcast that we've created together?
I mean, it was an honour to speak to Katy, and just listening to her story just tells you the type of things that people have to go through. I mean, she's clearly been incredibly brave, has gone through a time where things were so serious and she didn't grasp the seriousness of it. But then it dawned on her, and how she had to deal with her diagnosis, her young family. But clearly she used a great strength of character, humour as well. I thought she was very funny. I think now I will go and read up much more about Benazir Bhutto, and I do feel like just going to have a couple of ice lollies as well. But her story wraps in so many things as well about steroids. We know about the Dexy's midnight runners now as well. But what's also, I think, extremely encouraging is that we have seen her come out on the other side. Yes, her myeloma is not cured, but it's well controlled, and she's living a very full and active life. Sally, you've looked after her for a number of years. What are your reflections on that conversation and your journey with her?
It's really lovely, isn't it, to hear Katy talk not just about her disease and living with it, but her life around it. And as you say, really, how her life has continued, and actually how her life has evolved, albeit in a direction I'm sure she wouldn't have opted for originally. But nonetheless, she's continuing, she's working, she's looking after children, she's starting her own business, quite remarkable. But I think it's also really important to say, and I'm sure you would agree with this, that every patient is so different, and there are similar stories out there with every person that we look after. And yes, Katy's young, and if you listen to the stats about myeloma, it's not your average age to be diagnosed. But nonetheless, there are a lot of people out there who are juggling all these different aspects of their lives. And of course, as people live with myeloma, and if you're older, you'll have different challenges. But it was so useful to once again hear her perspective on what it was like for her. And I guess as we go through this podcast, I hope that we can introduce more patient voices who will share their different experiences, and that will enrich all of us, I hope, together.
This has been the first patient story, but there will be many more people at different stages of their journey, people at different stages of their life. So thank you very much for listening. Sally, thank you for bringing Katy on the pod, and thank you, Katy, so much for sharing your story with us.
Absolutely, and looking forward to the next one. And wish everybody a good week in the meantime. And just to say, actually, before we forget, look out for the next podcast. We're hoping to cover smouldering myeloma, so hopefully that will be a nice, interesting subject for everybody.
See you in the next one.
This has been the Myeloma Minutes. We hope that you found today's pod engaging, interesting, and above all, useful and understandable. Please remember that this does not constitute medical advice. Thank you so much for listening. Please do feedback on what you've enjoyed and what you'd like more of. You can email us at themyelomaminutes@gmail.com, and we'll see you at the next one. Bye.